Hi, thank you for joining me for the last class in antitubercular drugs. And as I mentioned in the previous one, that there are certain updates that has been added with the extra drugs into it. So with that, I will be trying to cover it up in this particular class. And I will be just stressing out certain important nursing care that needs to be done during this anti-tubercular treatment regimens while it is being going on. Now the first drug I want to stress on is levofloxacin. Levofloxacin. So levofloxacin is available under the brand name Levoquin, and it is used in combination with rifampin. And any other antitubercular agents for treatment in multi-drug resistant tuberculosis. Okay, so it is usually used with rifampin, and even if we can combine it with any other antitubercular drugs, and it is used in the treatment of multi-drug resistant tuberculosis. And due to its safe profile, or due to its safe administration on an oral basis, okay, this has turned out to be the most beneficial medication, and it is being used for treating multi-drug resistant tuberculosis, which was caused by those which are resistant even to the first line drugs. So in such cases, levofloxacin has proved out its worth even while it is being administered on oral basis. And mechanism of action is it will be inhibiting bacterial topoisomerase 4, and DNA gyrase, which are required for DNA replication, transcription, repair and recombination. Okay, so with this, levofloxacin has proved out its worth. The next one I want to stress out is rifapentin, and it is available in the markets under the brand name Priftin. Now this has been used twice weekly as part of the multiple drug regimen for 2 months during the intensive phase of tuberculosis, followed by once weekly for 4 months. And this is being used along with isoniazid or as an appropriate agent for susceptible organisms. Indications: adults, then children aged 2 years or older with latent tuberculosis in combination with isoniazid as once weekly therapy for 12 weeks. And this inhibits DNA-dependent RNA polymerase in susceptible strains of Mycobacterium tuberculosis. Contraindications: active tuberculosis in individuals with HIV infection, positive TB cultures after 2 months of treatment. Okay, then moving over to the next drug is bedaquiline, and this is available under the brand name Cetiro. Now it is actually a diaryl quinoline, and it inhibits Mycobacterial adenosine 5-triphosphate synthase, an enzyme which is required for the production of energy in the organism. And this is indicated as a part of 24-week multi-drug regimen with at least 4 other anti-tubercular agents in adults as well as in adolescents aged 12 years or older with pulmonary multi-drug resistant tuberculosis. And this has been reserved for use when all the other effective treatment fails. So in that particular case, this particular bedaquiline will be used. And contraindication is latent, extrapulmonary or drug sensitive tuberculosis. In these areas, we have to avoid the use of these drugs. And the last drug Pretomanid. Pretomanid. It is actually a nitroimidazooxyzin. Nitroimidazooxyzin, and it kills actively replicating Mycobacterium tuberculosis by inhibiting mycolic acid biosynthesis and thereby blocking cell wall production. The cell wall production will be inhibited or it will be stopped, and as a result this particular organism will not be able to survive without proper synthesis and everything taking place. And this is indicated as a part of combination regimen with linezolid, which is actually another antibiotic, for treatment of pulmonary extensively drug resistant TB or treatment intolerant or non-responsive multi-drug resistant tuberculosis in adults. So these were the extra drugs which has been added as a plus point or as a additional purposes into this anti-tubercular drugs agents, and these are also coming under the second line drugs. Now I would just stress on about the nurse's responsibility. Now one thing we need to understand is this anti-tubercular regimens or the anti-tubercular treatment. We have broken it down into regimens. Okay, so during this particular regimen, the nurses have to ensure that the patient takes the medications on time. The reason is if they discontinue or they forget to take a particular drug, or if they discontinue on their own basis, then it's going to be harmful, and the patient, instead of getting recovered, they even get even more sick than how they were initially. And this bacilli, it begins to replicate or it multiplies more in number and carries out its activity even more stronger when compared to the first phase. All right, and this is a time where even the multi-drug resistance and all starts, and when the failure of the medications initially on the initial basis and everything, whatever we have tried out, everything comes to a failure. So being a nurse, we have to ensure that the particular patient takes all the medications on time. Secondly, there are a lot of toxicities being associated with this anti-tubercular regimen, so they need to ensure that regular or a baseline or a periodic liver function test, thyroid function test, even the kidney function test, and a baseline investigations have to be carried out. The visual examination has to be carried out. In some areas it causes ototoxicity, so hearing examination should be done on regular basis. Particular education has to be given to the patient, like for example like rifampin and all. There are changes in the urine color, so we need to educate the patient on those things. Like it is a reaction, or it is usually observed when the patient is on this particular drug. So there are certain education that you have to do, and at the same time the patient has to be monitored, or their cultures, the sputum cultures also should also be taken up during this particular time and continuously monitored. And once they are put on the maintenance level, ensure that they take it up and they follow it up. Sometimes they get fed up, psychologically upset, everything will be there. So, and also moreover, ensure that they don't go for ethanol ingestion, because it can trigger psychotic reactions. So these are certain, or these are some of the important things the nurses have to keep in their mind once they start off with the regimens, like combination regimen or any kind of multi-drug regimens, whatever it is. Maybe it will be a 12-week or it may be a 24-week regimens, whatever it is. The nurse has to ensure that patient takes it up very well. A screening test should also be carried out, and the patient family members, all they should be under supervision. So with this, I have completed anti-tubercular drugs. So basically anti-tubercular drugs, you have first line drugs and you have second line drugs, and I have added, or I have just updated the second line drugs with certain new drugs which were being included, which serves a particular purpose in this multi-drug regimens also. So I hope you enjoyed the class. Take care, stay safe. Bye bye.